Hi, my name is Margaret Hartigan. I'm a member of the University Liggett School class of 2020, and for my academic research project, I studied worldwide insulin access. As a person with type 1 diabetes, and whose father, grandfather, aunt, and uncle also have type 1 diabetes, issues related to this illness are extremely important to me. That is why my academic research project looks into the medication which is vital for type 1 diabetic survival. Within the past few years, insulin prices have risen astronomically within the United States, often costing upwards of $300 for a 10 milliliter vial. And in impoverished nations, insulin is frequently both expensive and altogether not available. I wanted to learn more about the impact of high insulin costs and some potential solutions to the issue. So I dove into the question of how can technology, advocacy, and public policy be used in both the United States and developing nations to help improve public access to insulin. My research on this question eventually accumulated into an article, which was published to the website News Decoder and was featured on other sites. For those who are interested, here is an audio version of that article. Insulin Access, a Challenge for Governments, Diabetics by Margaret Hartigan. David Sorreo is a type 1 diabetic from Portugal, but has lived in the city of Angiva in the Cunene province of Angola for the last several years. In Portugal, the National Health Program covered the cost of Sorreo's insulin. In Angola, Sorreo is not so lucky. Quote, "You have to pay 100% of everything you need, since the National Health Program is very incipient," end quote, Sorreo said. Quote, "And the farther away you are from the capital, the worse it gets," end quote. Rather than relying on Angola's limited supplies to furnish his needs, Sorreo regularly travels back to Portugal to purchase insulin. Unfortunately, many people with type 1 diabetes are not so fortunate. Half of all people who need insulin lack the financial or logistical means to obtain adequate supplies, says T1 International, a global diabetes advocacy group. Insulin is a hormone that converts carbohydrates in food into energy that the body can use. Individuals with the autoimmune disease known as type 1 diabetes have immune systems that attack and destroy the cells in the pancreas that produce insulin, which causes sugar levels in their blood to rise. To maintain their blood sugar levels, people with type 1 diabetes must inject themselves with insulin several times per day. Failing to do so can result in weight loss, nausea, thirst, and, in extreme cases, coma or death. In developed countries like the United States, the price of insulin is extremely high, costing upwards of $300 per 10 milliliter vial, of which the average type 1 diabetic requires 13 per year, according to a 2015 study by Health Action International. The high prices prevent thousands of Americans from accessing insulin and causes numerous deaths from insulin rationing each year. A 2018 study by researchers at Yale found that 1 in 4 Americans with insulin-dependent diabetes have taken less insulin than needed due to the high cost. In developing countries, the situation can be even more serious, as insulin is often completely out of reach. Quote, "I knew a guy from Capo Verde who was working in Cunene," end quote, Sorreo said. Quote, "Diabetic, and he was on his 6th month without insulin because he couldn't afford the trip home to buy it," end quote. In middle and low-income countries, such as Angola, Vietnam, and Mozambique, the price of insulin is not as high as it is in the United States, but is still not affordable for most. Nearly half of people with type 1 diabetes in low and middle-income countries have no health coverage for any of their diabetes-related costs, according to a 2018 report by T1 International. In Mozambique, the cost of a year's worth of insulin is about $80 or $6 per 10 milliliter vial, which is nearly 6 times the government's average healthcare expenditure of $14 per person, according to the Health Action International study. In a country where the annual gross domestic product per capita is $415, $80 is too much for most people to pay out of pocket. Lacking insulin, a child with type 1 diabetes in a sub-Saharan African country such as Mozambique has a life expectancy of less than 1 year following diagnosis, according to Health Action International. Need in this region continues to rise. Throughout Africa, there are an estimated 39,000 children under 14 with type 1 diabetes, with approximately 6,400 new diagnoses each year. Where governments have struggled to solve this crisis, nonprofits have sought to help. T1 International has conducted research on worldwide insulin access, pressed for legislation to regulate how much manufacturers can charge, and, perhaps most importantly, provided advocacy training to people with type 1 diabetes so they can fight for their own drugs. Another nonprofit, Insulin for Life, relies on donations to send insulin and other diabetes supplies to low-income nations and natural disaster zones. According to Carol Atkinson, director of the U.S. branch of the program, Insulin for Life has helped an estimated 6,000 people with type 1 diabetes in low-income regions, as well as many more through their disaster response programs. The Open Insulin Project has a team of biohackers, or do-it-yourself biological engineers, who have been working since 2016 to create a cheap way of producing the drug. The Open Insulin Project hopes to eventually establish labs that provide insulin to 10,000 people per lab. They expect it to cost a mere $10,000 to establish a single lab, less than the cost of a year's supply of insulin for 3 Americans with type 1 diabetes. Thank you for listening to my academic research project presentation. I want to thank Ms. Minwala, Dr. Larson, and all of the individuals who contributed to getting this article created and published. If you have any questions, feel free to contact me, and if you would like to read the full article, go to newsdecoder.com via the link attached.